Hello, I'm Julie Aiken. I am a public health student at Georgia College and State University. I am on my last semester, yay. This past semester I've been completing an internship um, in Milledgeville, Georgia. It is a laboratory and I was hired on as a floating position, and part of my internship course was that I had to complete a semester-long project. So I chose to do my topic over STD prevalence because I do work at a laboratory and that is something that we test for. So let's get started. Just gonna pull up my PowerPoint. Okay. Let's see. Okay, I believe it's sharing. So let's hope so we don't have to do this again. Okay, so again, my topic was over the prevalence of STDs. I am really interested in this topic because there is a problem. There is good news. We have been making progress, but there's always more to do. So I looked at a couple of different areas. I looked at Baldwin County, which is the county I am living in at the moment, and I looked at Georgia as a whole, and I also looked at the United States as a whole. So I'm going to begin, and I'm going to introduce my internship site. So I worked at Medlake. A little bit about Medlake. It is a CLIA, COLA certified full reference laboratory. So this laboratory, it's located in Milledgeville, Georgia, and you would not believe the amount of technology that we have in Milledgeville. I've talked with some people that work there, and they have all said that you're not going to find this type of technology, this type of equipment anywhere but like huge universities like the University of Georgia or Georgia Tech. We are also board certified. We're HIPAA compliant. So part of my internship site, a part of what I had to do was I had to learn how to manage sensitive information. So I had to see drug screenings, STD results. I had to see insurance. I mean, I saw every single bit of sensitive information that there was. I had access to. So I had to go through a little bit of HIPAA training so that I didn't, I don't know, write in my journal entries sensitive information that I shouldn't have, you know? So I had to learn how to be HIPAA compliant. We have a fast turnaround time. So Medlake prides itself on its fast turnaround time. We have carriers that come in and they bring urine samples, blood samples, molecular samples, like COVID swabs, RPP, all sorts of different things. So we have things come in daily, and our accessioning team works quickly, and they have a deadline. They've moved up the deadline since I've been there, so they have these turnaround times really, really quickly. Mostly 24 to 48 hours. That's what we promise our clients. Medlake has 3 different departments in the lab side, and it's chemistry, molecular, and toxicology. So chemistry is our blood tests. Molecular would be our respiratory panels and COVID tests, and toxicology would be our urine samples. So our mission and vision statement at MedLake is to deliver the highest standard of care in the laboratory setting. So what I continuously hear every single day at my internship site is that every specimen, every sample is a person's life. So we do get drug tests. So for example, if there's someone that doesn't have full custody of their child, they could test their urine, and we could make a mistake. We could mislabel. We could contaminate. We could make any mistake. So we make sure that we don't make mistakes, and we do have technology that picks up these mistakes early on, so that we don't take away someone's right to see their child or send someone to jail or anything like that. So our vision statement is to deliver quality care for our customers, focused on fast turnaround times, which I already covered, reporting accurate results with innovative technology and superior customer service. So we do have a drive-through, and I have been able to work with Miss Janice and provide some of this customer service that is spoken of in our vision statement. So my role, I'm a floating position. So I go wherever necessary. I have been in accessioning, customer service, compliance, billing, drive-through, all three departments in the lab, and the send-outs. So I'm going to just briefly go over each of the departments so that you can get a better understanding of the lab and how it operates. So accessioning is where I started. What we do is we put in samples. So we receive the samples in the system, which is called Copia, and we put in demographics. We put in the tests that the techs need to test for. So without accessioning, it would be really hard to test samples and have a fast turnaround time. Customer service, I got to work with briefly. This is just like answering phone calls, scheduling appointments for the drive-through, and answering any questions that a client may have. So I also worked with compliance, and Courtney is actually who helped me pull the information for this project. So I have all of the data from Courtney. She is a master at Excel. It's crazy. I also worked in billing, so I filled in. I went through insurance recs. I made sure that insurance was active and that it was input correctly in accessioning. I worked in the drive-through, which I loved. Sadly, it's become a little bit, well, not sadly, it's a good thing that it's become a little slower because less people are testing positive for COVID-19, and it's a good thing. But I loved the human interaction. I loved patient interaction. Testing for COVID-19 is not very fun. It's not something that people like to do. But Miss Janice has taught me some ways to get people through it and to get them smiling, actually, while a swab is like halfway up their nose. I mean, it's amazing. And the patients are always just really, really sweet, and they really work with you. We do have the occasional difficult person, but all in all, everyone's really, really nice. So again, I'm going to cover toxicology, molecular, and chemistry. Toxicology is our urine samples. So we do drug screenings, STDs. In molecular, we do our COVID-19 tests, our respiratory panels, and in chemistry, we do blood tests. So lastly, there's the send-out department, and this is where if there is if a sample has passed a deadline, let's say, other laboratories have different stabilities. So we have a certain amount of time that we can test a sample that we're okay with, that we're comfortable with doing. But other labs have different stabilities, so we'll send it out to other laboratories to be tested. If we don't do a test, we'll send it out. Okay, so on to my presentation about STDs. This is what I've been working on the entire semester. I'm really, really excited to get it presented. So STDs are tested in 3 different ways. There's blood tests, and this is going to test STDs like herpes, HIV, syphilis, and hepatitis. Urine tests pick up our bacterial STIs, STDs, such as chlamydia and gonorrhea, and our swab tests. Women know about the pap smears, and that's taken from the cervix. Men will get swabbed in the penis or the urethra, and there's also tests that can be taken orally, so we can just swab in the mouth, and that can detect chlamydia and gonorrhea. And then the other swabs like the pap smear and can detect chlamydia, gonorrhea, trichomoniasis, syphilis, and herpes. And those are just some of the STDs that these types of tests can detect. So I actually got to go on campus. I don't have any classes on campus this semester, so I was really excited to go and talk to some students and be back on campus. So I just kind of stood at the fountain and I asked a couple of students 3 questions. I asked them, what do you think is the most commonly spread STD in Milledgeville? What do you think is the most commonly spread in Georgia? And what do you think is the most commonly spread in the United States? So I think I got 36 individuals to answer. It's on my next slide. But I'm going to move on to a video really quickly so that we can cover STDs and what they are and just get a better understanding, and then we'll get the results to these questions that I asked. So there's an ad. All right.
Today's topic is sexually transmitted diseases, or STDs. Sexually transmitted diseases, also referred to as sexually transmitted infections, are infections that are majorly spread by sexual contact, especially vaginal, anal, and oral sex. Some STDs can spread through non-sexual contact, such as through the use of unsterilized drug needles from mother to infant during childbirth and breastfeeding, and blood transfusions. Sexually transmitted diseases that are transferred to an infant during childbirth may result in poor outcomes for the baby. To help prevent STD in newborns, doctors always encourage pregnant women to be tested and treated for potential STD, even in the absence of any symptom. Some sexually transmitted diseases may cause infertility in both women and men. There is a greater risk of passing the disease on to others unknowingly, because sexually transmitted diseases initially do not cause symptoms. The most common STDs are chlamydia, chancroid, pubic lice or crabs, genital herpes, hepatitis, trichomoniasis, HIV/AIDS, gonorrhea,
you can guess what is
syphilis,
the most common in the
scabies,
I mentioned.
molluscum contagiosum, ureaplasma infection, human papillomavirus or HPV. Many STDs are curable, while some are not curable. Some curable STDs include syphilis, crabs, gonorrhea, trichomoniasis, and chlamydia, while the incurable ones include herpes, HIV, human papillomavirus, and hepatitis B. In 2015, about 1.1 billion people were reported to have STDs. Other than HIV/AIDS, this resulted in about 108,000 deaths. About 500 million were infected with either syphilis, gonorrhea, chlamydia, or trichomoniasis. An additional 530 people had genital herpes, and about 290 million women had human papillomavirus. Causes. STD can be caused by bacteria. Bacterial STDs include gonorrhea, syphilis, and chlamydia. Parasites. Parasitic STDs include trichomoniasis, pubic lice. Viruses. Viral STDs include human papillomavirus, genital herpes, HIV. The genital areas are usually moist and warm environments, ideal for the growth of bacteria, parasites, and viruses. Factors that may increase the risk of getting STD are having unprotected sex, having sexual activity with multiple partners, having a history of STDs, needle sharing, being young. Half of the STDs occur in people between the ages of 15 and 24. Symptoms. Painful or burning urination, pain or discomfort during sex, unusual or odd-smelling vaginal discharge, fever, lower abdominal pain, unusual vaginal bleeding, penis discharge, sores, bumps, or rashes on or around the penis or testicles, sore, bumps, rashes on or around the vagina, sore, bumps, rashes on or around the anus, buttocks, thighs, or mouth, painful or swollen testicles, itchiness in or around the vagina. Diagnosis and treatment. In most cases, STDs cannot be diagnosed based on symptoms alone. If the doctor suspects that you might have STD, they'll likely recommend tests to check. Tests may include blood tests, urine samples, fluid samples from active genital sores. STI screening is important for everyone, including pregnant women, women aged 21 and older, women under age 25 who are sexually active, men who have sexual contact with men, people with HIV, and people who have a new partner. Screenings are done while symptoms are not present. This may help in preventing STDs and the complications associated with the condition. Treatment. Treatment varies depending on the type of STD that you have. For pregnant women with an STD, prompt treatment can prevent or reduce the risk of your baby having the infection. STDs caused by bacteria are easier to treat than viral STDs. Viral infections can be managed but not always cured. Antibiotics can cure bacterial and parasitic STDs. Antiviral drugs can keep infections in check for many years and reduce the risk of transmission. Medications are available to reduce the frequency and severity of herpes outbreak. You can prevent or lessen your risk of STDs by abstaining from sexual acts, vaccinations, having one sexual partner, drinking alcohol, or avoiding recreational drugs, which may increase your chance of engaging in risky behaviors or affect your. Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the.
All right, so let's get back to it. So I just wanted to show that video so that people could understand the different types of STDs and maybe get a better guess of what was the most common in the different areas that I mentioned. So in Baldwin County, in Georgia, and in the United States. So I do want to go over some statistics too before we show those results. Adolescents account for 50% of all new STIs in the United States each year. So understanding that our youth is makes up half of our STDs it's alarming. So maybe better education methods would be helpful. I know that when I was in school, I was taught just do not have sex. Just don't do it. Here's a paper sign and make sure that you don't have sex before you're married. And maybe that wasn't very helpful. So also moving on, 1 out of every 4 sexually active adolescent females have an STI. More than 30 bacteria, viruses, and parasites are known to be transmitted through sexual contact. That's crazy. More than 1 million STIs are acquired every single day in the United States. 1 in 20 sexually active young women aged 14 through 24 years old has chlamydia. So again, is that another hint as to what's the most common? I don't know. We'll see. Trichomoniasis has a prevalence estimated at 8 million cases annually. So from that video, we know trich and chlamydia are very common. Is that a hint? So here's our results. So I did have 36 students that answered me. 19 of them responded with chlamydia. 19. That's 53% of our students think that chlamydia is the most common. 4 answered HPV. What we know about HPV is it's very common. I don't know if it's the most common. We'll see. Gonorrhea, people said 10. So that's the second most that people said. And herpes was the least amount of people answered it, and it was 3. So I don't know if you can see this graph very well. I wish it was a little bit bigger. It looks a little blurry on my side, but that I also don't use Zoom much, so I don't know if you can see it. So 53% of people answered chlamydia. 11 answered HPV. 29% gonorrhea, and 8% herpes. So our students really think that chlamydia is the most common. I hope that helped a little bit. All right, so moving on. At Medlake, we do some STD testing. Again, I worked with Courtney, and she was really, really helpful at getting the results really quickly. So we pulled data from March of 2021 through February of 2022. That's when I got my results to begin this project. So what I learned was that trichomoniasis was the most commonly positive result at Medlake. So that was the most positively reported STD at Medlake. So out of 638 tests since March of 2021, 11 of them were positive. That's not a big number, but a positive about this is that it's not a big number, and a lot of people are testing. Chlamydia was the second most. So out of 639 tests, 5 tested positive. And then out of curiosity, I wanted to know about HIV. I wanted to know how many people test positive, how many people are testing. So in a year span, 128 tests were completed. So that's not a lot. But 4 of them were positive. And what I noticed was that everybody that tested positive for HIV also tested positive for other STDs. So it got me thinking, what is making this happen? Well, sharing needles, having multiple sex partners, and different things can cause this issue. So what is trichomoniasis? It's a very, very common STD. It is a parasite, and it's Trichomonas vaginalis. I don't know if I'm pronouncing that right, but that is a protozoan that causes this STD. So the mode of transmission is men to women or women to men through vaginal sex. So vaginal fluids, pre-cum, and semen can cause this STD. It can also be transmitted from mother to child during the birthing process. Um, and some symptoms that you might need to be aware of is a foul-smelling vaginal discharge, genital itching, and painful urination, and then also premature delivery. In men, they don't typically have symptoms. So when an STD goes asymptomatic and a person just continuously has different sexual partners, it's going to be spread. So regular testing is really, really important because there are asymptomatic STDs and STIs. So moving on to chlamydia. And these are our two top tests, positive tests at Medlake. That's why I am going over what exactly they are. So chlamydia is very, very common. It's caused by a bacteria, so a little different than trichomoniasis, which is caused by a parasite. So it's caused by a bacteria, and it's called Chlamydia trachomatis. I don't know if I'm pronouncing that right, but that's what it's caused by. Its mode of transmission is through oral, vaginal, or anal sex. So symptoms in women, abnormal vaginal discharge again, foul smelling discharge again, a burning sensation, and pain during intercourse. Symptoms in men are discharge from the penis, a burning sensation when urinating, itching, pain and swelling of the testicles. And then sometimes none at all. So again, it's really, really important to test because these can go undetected. So STDs can affect the body a little bit long-term and short-term. So I went over some short-term effects from chlamydia and trichomoniasis, but these are a little bit of our long-term effects. So pelvic inflammatory disease, infertility in both women and men, tubal or ectopic pregnancy, cancers such as cervical and testicular, and one of the major STDs that causes this is HPV, as we learned in our video that we watched at the beginning of this presentation. It can also, STDs can cause transmission to children when they're being born. I mean, babies when they're being born because their mom has an STD. It can also cause stillbirths, neurologic damage, and even death. So looking at Baldwin County, I saw this community health assessment, and we're going to look at this website in a minute because there's very, very helpful graphs that I found. But I took some notes down because I thought that this would be really helpful to understand Baldwin County's issues. So Baldwin County ranked 31 out of 159 counties for the highest number of chlamydia cases. They ranked 20 out of 159 for the highest number of gonorrhea cases. And they ranked 24th out of 159 counties for the number of syphilis cases. So our top three STDs in Baldwin County are chlamydia, gonorrhea, and syphilis. And we are pretty high on the prevalence. So I'm going to go to this website because they had some very cool graphs that I wanted to show. Let me just scroll down. I know it's on page 10, I think, 10 or 11. Let me find this. Let's see. I was way off. It's 30. Okay. Okay, so I want to show these graphs. So this is our chlamydia, and these lines. So this green line right here at the very top is Baldwin County. This red line is the North Central Health District, and this bottom blue line is Georgia. And these, it's from 2007 to 2011, and this is the chlamydia rate. So Baldwin County is way higher than the Georgia average in 2007 to 2011. This is the most recent health assessment that I could find. I wish I could find something a little bit more recent, but this is still useful information to understand that we have a high STD rate per 100,000 people per our population. So this is chlamydia by age group. So this 18 to 19 range, I mean, it's our youth. So moving on, they did the same thing for gonorrhea and syphilis too. So gonorrhea again. So this is our Baldwin County Health line, and this is our North Central Health District, and this is Georgia. So again, Baldwin County is just way higher than the Georgia's average, like way higher. I guess throughout years we did decrease, but in previous years we were just way higher. So again, our younger population. Okay, so here is syphilis. So this is a little bit more difficult to see. Yeah. Ooh. Sorry. So this is our green line. This is our Baldwin County line. So we did get our syphilis rates down throughout the years, which is a good thing. See, there is a silver lining. And for syphilis, it's really, really interesting. Our older population, middle-aged population, not older population. It's not our youth. It's our middle-aged population. And then this is our HIV, just because out of curiosity. So we had, wow. So in 2011, we did decrease, but we were still at 10, and we do have a small population. And here's just the age group. All right. Okay, so we're going to move on to Georgia. So in Georgia, our number one STD, our number one most common STD is chlamydia. So that was also an STD that was common in Baldwin County. And then number 2 is gonorrhea. Number 3 is syphilis. So I believe syphilis was also in Baldwin County too for the top 3. Yeah. And gonorrhea. So they had each one in common. So chlamydia is the most common STD in Georgia, and Georgia actually ranks 7 in the entire United States for the most common cases, most cases of chlamydia. So in the U.S., HPV is the most common STD. The CDC reports that 80 million people are infected with HPV in the United States, and of them, 14 million of them are teenagers. So again, our younger population, we really need to find ways to encourage safer sex and have a different way of educating our youth on sex and STD prevention. Number 2 is chlamydia. So again, that's a common STD. And number 3 is gonorrhea. And this is just the amount of cases as of 2019 in the United States. So, All right, so Georgia College has a website that was put out by the National College Health. It's a National College Health Assessment, and it was put out in 2019, so it's very recent. And I just wanted to show, I think this one was page 10. 10 or 11. Yes, so it is it has a lot of useful information. You should really go and check it out. It has stuff on, it has stuff on injury prevention, academics, tobacco use, alcohol, mental health, sleep, everything. It's really, really useful. I found it really useful during this process. So for sexual behavior, our college students reported having the following number of sexual partners within the last 12 months. So 31.8% of males had no sexual partners within the last 12 months. 35.6% had none, and 35% had none total. So most people had 1% or one person for a sexual partner. But I thought it was really interesting to see the amount of sexual partners for Georgia College students. So this is just how many people had at least one. And then it also has like oral sex, vaginal sex, and anal sex. How many students are participating in these risky sexual activities? So almost half of students are participating in vaginal sex. More than half and almost half of students are participating in oral sex. And a few people are participating in anal sex. So this is what really I wanted to show. It shows the amount of birth control, like how many people are using condoms. So this one says condoms and other protective barriers within the last 30 days. So most people are not using condoms. Definitely not during oral sex, and definitely not during anal sex. And then only half are using condoms during vaginal sex. Okay, so this shows our methods of birth control. So this was really, really interesting. So 68% of males are using birth control pills, 65.2% are using birth control pills, and a total of 66.1% are using birth control pills. So a lot of people are using birth control pills, and then coming in second, a lot of people are using condoms. And then the pull-out method or the withdrawal method. So this is the morning after pill. How many people have used the morning after pill? About 20% in the last 12 months. And then Georgia College students, 1.5% experience unintentional pregnancy. So I really thought that that was a good tool to understand how is our student population dealing with sex. I mean, what are we using birth control? Are we just risking it? Are we contributing to that problem that Baldwin County has? So comparing, Medlake's most commonly positive STDs were trichomoniasis and chlamydia. Baldwin County was chlamydia, gonorrhea, and syphilis. Georgia was chlamydia, gonorrhea, and syphilis. They were the exact same. The United States was HPV, chlamydia, and gonorrhea. So out of all of them, there is one common STD, and that is chlamydia. So, and that was number one for the longest time before HPV beat it out as the most common. So again, the importance of testing. A lot of STDs don't have, like, they don't produce symptoms. So you're not going to feel anything, and you're just going to continuously spread this STD if you don't get tested. So that's just, if it's asymptomatic, you're not going to know. And that can cause health problems. So the importance of testing is to just make sure that you can take control of yourself. Make sure that you're being open and honest with your partners, making sure that your partner is safe. You're not putting your partner at risk. Long-term effects may be worse if STDs are left untreated. So again, it can lead to certain cancers. They can lead to stillbirths, infertility, and then, sorry, I have something in my eyeball. And then preventing the spread, therefore promoting safer sex for everyone. Okay, so findings and influence. So I have created a poster and I placed it all around Georgia College, the Georgia College's campus, to inform students of the importance of regular testing. So it, all of this data that I pulled and all of the research that I've done throughout my internship experience, it shows myself, a better understanding of the risks associated with STDs. And I wanted to share this with the Georgia College population. It showed me better knowledge on what STDs are most common. Again, what I wanted to share with the student population, and the methods of prevention. So different birth controls, like an IUD, the birth control pill, a condom, whatever, what have you, and then regular testing. So this is my poster. Again, I don't know if you can, I don't know if you can see it well. I will try to make it a little bit bigger. If this does not work, I did print out a picture of it so I can show you at the end of my presentation. And I do have it with me. It's just not in the beautiful colors that I had worked on. But I showed the Georgia College population about different statistics, some that I put in this PowerPoint, but also that approximately 20 million new STD infections, there's approximately 20 million new STD infections a year in the United States. And that 1 in 20 young women aged 14 to 24 has chlamydia. And then 24,000 women become infertile each year because of an STD. I also talked about the findings, so what the most common STD in Georgia, what the most common STD in the United States, and what the most common STD in Baldwin County was, so that they could really see what they need to look out for, and maybe what they need to ask their doctor, make sure that they're being tested for it, like HPV, chlamydia, gonorrhea, and syphilis. And then I also put a section knowing the symptoms. So knowing that there may not be any symptoms at all is a risk. Understanding that abnormal vaginal discharge may be a sign that you have an STD, painful intercourse, burning urination, pain and swelling of the testicles, and itching. I also talked about the different testing methods, so blood tests, urine tests, pap smears, and then the penile swabs. And then safe sex methods, so condoms, IUDs, birth control shots, pill, diaphragm, and the cervical cap. And then I explained the background of why I'm posting this poster around campus. Why is it important? So I said STD testing is effective at preventing the spread of STDs and preventing serious medical conditions associated with STDs. Many STDs have no signs or symptoms, so individuals may be spreading unknowingly. Some STDs can result in serious health problems. STDs can result in pelvic inflammatory disease, cancers such as cervical and testicular, infertility, stillbirths, neurological damage, and death. So here's just, I don't know if you can see my print on the PowerPoint, but I do have it here and I will show it at the very end of the video. It's just not as pretty as the one that I created and posted around campus. So that is all. Here's my citations. So I'm going to stop sharing my screen. All right. So again, as promised, here is, this is not working very well because the screen is flipped, duh. But here is my poster. And I will also submit it to Dr. France, or Dr. Canonjing, and yeah. But Georgia College students have this. And I've showed my internship site coordinator as well. All right, well, thank you for listening to my presentation. I hope you enjoyed it. I've been working really hard on it this semester, so I really, really hope you enjoyed it. I hope you learned something and get tested.